It's time for a booster shot. That's the latest from doctors around San Diego as the county sees a spike in COVID-19 cases. Good evening and thank you for joining us. I'm Carlo Cicchetto.
I'm Marcella Lee. For what you need to know about COVID right now, let's go to CBS 8's Kirsten Holmes. She's live at Rady Children's Hospital, where doctors say this round of vaccines is for everyone. Kirsten?
That's right. We talked to doctors here at Rady Children's Hospital, at UCSD Medical Center, and the San Diego County Department of Health. And they all say that the first round of vaccines are already available at some doctors' offices and pharmacies. But they also say starting next week and through the next couple of weeks, more vaccines will be readily available for you and your family to better protect yourselves against the virus.
We have been seeing kids in the hospital being treated with remdesivir. But we really haven't seen severe disease, and certainly the sheer numbers that we saw during the peak years of the pandemic.
Dr. Edmund Milder at Rady Children's Hospital says this late summer, early fall spike in COVID-19 cases we're seeing in San Diego County could be a lot worse if so many people weren't vaccinated. And Dr. Milder says it's time for a booster shot if you are vaccinated.
It's recommended for everybody 6 months and older. So there was a lot of debate about whether it should be targeted at higher risk populations, but modeling suggested that giving it to everybody would give the broadest protection and save the most lives.
There are a few ways you can get vaccinated. You can visit vaccines.gov to find a location near you anywhere across the country. And right here in San Diego, we have myturn.ca.gov, which specifically helps Californians find vaccination sites near them. Most vaccines are now administered at your doctor's office or pharmacy, but for others who don't have insurance or need a free vaccine,
and the county will be offering vaccine, but we will be offering at our public health centers to those that are uninsured to make sure that our most vulnerable populations that may not have access still would be able to come to a public health center to get a vaccine.
Dr. Davey Smith at UCSD says this specific shot is ready for this year's strain of COVID-19.
Virus has been evolving, so this vaccine is specifically based on the variants that are circulating now. And two, our immune systems have a faulty memory. They sometimes forget. So it's required for us to get a booster every now and then.
Some patients we talked to today say they've had a little bit of difficulty getting the vaccine right now. They say that they've had their appointments canceled on the same day or delayed for later in the day. The doctors we talked to today say the vaccine is still being rolled out, and as time goes on, starting next week and in the coming weeks, those vaccines will be more readily available at doctors' offices and pharmacies. Reporting live for CBS 8, I'm Kirsten Holmes. Back to you.
Kirsten, it's also the time of year for flu shots. What are doctors saying about getting both vaccines, the COVID-19 vaccine and the flu shot, at the same visit?
Doctors say they would prefer for everyone to get that COVID-19 vaccine and their flu shot all in the same visit so that we can all be better protected as we head into the fall and winter months. Marcella?
All right, Kirsten Holmes reporting live for us at Rady Children's Hospital. Thanks.